Thank you for joining us today. My name is Jennifer Kirschenbaum, and I am counsel to Nassau County Dental Society. And I am here to give an update on our situation from the legal end on COVID-19. This is our second in the series of what's happening out there. And just to give a disclaimer on what I'm going to cover today, I tried to pull from government resources to the extent available. We'll see some information from NIST and from the governor's office and from the federal government on what's happening right now for practice owners. And this is specifically dental geared. And I'll try to go through some questions that we've received from dentists over the course of the last 2 weeks and see if we can answer some questions at the end from our audience. Okay, so our agenda for today, we're going to go over essential services, the legality of health screening for patients and staff, sick benefits that are available for our employees at the moment. I'm going to go over the federal bill that has not been signed into law yet, and the language is still changing. So it's somewhat speculation, but I think that the concept of the loan structure that we're going to talk about is fairly set, so we can have some guidance there. We'll go over some miscellaneous business items. Teledentistry we'll touch on, and termination, and then we'll go over some frequently asked questions. So right now, what we're operating under is Governor Cuomos' pause, which exempts dental practices for emergency care only, and we're going to talk about what that means. But you are allowed to be open, you are allowed to see patients, specifically under the governor's legislation. Walk-in care health facilities is under there, and dental and doctor and emergency dental are available right now, allowed to be open. I do understand that many people are closed, and we'll talk about what that looks like. This is straight from the NIST website, and I understand that some people were questioning where this information came from earlier in the week, but right here on nysdental.org/COVID-19, NIST has posted that we are on pause. Only elective and non-emergent services must be postponed until, right now, that date is April 19th, 2020. However, that date, and this is from NIST, is subject to change at any time based on additional executive orders. And they state that if urgent dental treatment is necessary, dental and medical providers should work together to determine the appropriate precautions and setting on a case-by-case basis to avoid the potential spread of the disease. So I will add a note, and I don't think this is on the NIST site, but on some other specialty society sites that I've seen, if you have a known COVID positive patient looking for treatment, they should be sent to the emergency room. And that was on the American Academy of Ophthalmology website and a few others that I've seen. So that is the general guidance that I've seen for COVID positive patients with symptomatic. From the NIST website, and of course you can go down and read, I won't go through all of this, but they're stating that dental emergencies are only those that are potentially life-threatening and require immediate treatment to stop ongoing tissue bleeding, alleviate severe pain or infection. And they talk about specifics. They talk about urgent dental care, which focuses on the management of conditions that require immediate attention to relieve severe pain and or risk of infection. Now, most of this is going to be in your professional judgment, what you believe to be necessary for the patient to be relieved of severe pain or to stop potential infection. That's going to be between you and your patient. But some examples of what the NIST is determining is necessary is here. And this is not an exhaustive list. And if you feel that a patient needs to see you and you have to go in for something that's not on this list, then that's okay. What I would say to you is you have to be able to document in your chart why this is an emergency. And if you're seeing patients right now where when you look at the notes after, you feel that it could have been pushed off till a later date, the state is asking us not to see those patients at this time and to ask them to please remain home and schedule for when the pandemic has abated. So additionally, from the NIST website, they're talking about other urgent dental care, extensive dental caries or defective restorations causing pain. They're saying should come in, suture removal, denture adjustment on radiology oncology patients, So they are giving you a list of things that if you have patients calling for these things, you are an essential person. You are authorized to be operating your practice during this time, and they are looking for doctors to alleviate the rush on an ER, which could be a potential. Now, if you do not feel that you are the appropriate professional to handle the emergencies that are coming up, or you do not have the staffing to open at this time because you have put yourself in more of a closed trajectory, then you need to look in your community and find which offices are open to see your patients. And it might be a specialty practice, it might be a general dentistry practice that is open, that's available. This is a time of emergency, and we need to make the best decisions we can for our patients as well as for ourselves and our practices. So please be sure to know where they can go. From the NIST website, dental non-emergency procedures, so they're telling you that this is what they consider to be routine and non-urgent. So please do not have these patients coming in right now. So initial or periodic oral examinations and recall visits can be pushed off. Any routine dental cleanings, so our hygienists, unfortunately, really do not have much to do during this time period. Orthodontic procedures, other than those to address acute issues, really have to be pushed off. Extraction, restoration dentistry. So these are the full list, and if you want to spend some time on the NIST website, I certainly encourage you to do so and just take a look and see what they consider to be urgent versus routine, and understand what it is that you could be open for during this time. Now, if you are having hours, are you authorized to screen patients and staff? The answer is resoundingly yes. You are authorized to ask questions that previously were potentially not appropriate or viewed as not acceptable. Now you're allowed to ask questions based on symptoms, whether they have fever. So this is advice from NIST specifically. They're telling you that you should be screening patients on calls in advance to create and confirm appointments prior to the patient's arrival. You're going to review infection control guidelines and personal protective equipment in your practice, and make sure that you have adequate levels of PPE for you to be able to operate safely. Review the CDC guidelines for workplace policies. This is what NIST is also recommending, as do I. Review sick pay policies for staff, because you may have some staff who are home on quarantine or potentially isolation, and they are not only entitled to be home for that, but they are entitled to certain pay, which we'll get to. You're going to remind staff to stay home if they or someone in their home is experiencing symptoms, because we cannot have further spread in your offices at this time. Our emergency rooms are quickly getting overwhelmed, and we are looking to, as we're calling it, flatten the curve. So please keep everyone safe. Now, for the on-site protocols, here is the OSHA link again, and I'll make the slides available for anyone who wants to request. I will send them, of course, to Dr. Porcelli and to Beverly at Nassau County Dental Society, and they can release as well, or you can email me directly and I'll send you a copy. But you can screen staff and patients we talked about. You should adopt hand washing protocols, make available PPE, reduce staffing levels at the location, so that way we can encourage social distancing. We're going to stagger patient appointments. Certain practices are having patients coming in only one at a time. They're really having a lot of spacing between appointment times, and then they are adopting specific sterilization processes for the exam rooms and for the location in general. So let's say that we just don't have any volume, or the staff are not willing to come in and we're looking to close. What do I do? How do I notify my patients? Do I have to notify my patients? Isn't it obvious that no one is open? You should have a notice out to your patients about what you are doing right now, whether that's teledentistry, which we'll get to, if you're going to make yourself available by phone and you're going to do consults by phone, or if you are going to go hide out somewhere and not answer, then you need to have a message up for your patients to know where they can go for care during this time period. So just make sure that whatever you do, it is public. If you have a website, certainly a voicemail recording if you're not going to have anyone answering the phones. If you are going to have staff working, answering calls, then we'll talk about what that looks like if they're not at full time. There may potentially be benefit available to them to qualify for certain unemployment rates and benefits. So let's talk about if we are staying open. This is if we are running our payroll and we have employees that are working for us. There are sick leave benefits that have been put into place specifically for COVID-19. And there is state benefit available and then federal that kicks in next week on April 2nd. As of right now, under New York State, employers with 10 or fewer employees are required to guarantee a job for an individual who's home on a quarantine order. Now, I want to be really clear about this. A quarantine order is not Governor Cuomo's pause. It's not everyone stay home, you qualify for quarantine. A quarantine order right now is for an individual who has a reasonable belief that they have COVID-19 or has been tested and is positive, and the Department of Health has mandated that they stay home and be quarantined for 14 days. It also covers, as you're going to see, it's going to cover for individuals that are home caring for someone who does have COVID as well. Now, under New York State, an employer that has 11 to 99 employees and has a net income of more than $1 million, which many of us on this call qualify for, we are required today to pay an individual who is sick and home and quarantined at least 5 days of paid sick leave. This is not cumulative with what you offer to employees currently. It is in addition to. So at least 5 days of paid sick leave. We're also required to give them job protection during this time. Now, in addition to this sick leave under New York State, they may also qualify for paid family leave if they are caring for somebody else, or disability benefits if they are sick and they themselves need assistance. Additional notes, if an employee is quarantined but working from home, he or she does not qualify for COVID PTO benefits. If they are working, they do not get the benefits. They are to remain on payroll. The employee may be eligible for additional leave under New York State paid family leave and disability benefits, which we just covered. But it's important for you to understand that and notify the employee that there may be another way for the employee to receive their salary. If an employer is closed due to COVID-19 or a quarantine order, employees can immediately apply for unemployment insurance. If you are closed or they are home, they can apply for unemployment. And there's going to be additional unemployment benefits, which we'll talk about under the federal law. These are just some frequently asked questions for you to understand what the obligation is right now, and then we'll get into how, of course, that is going to morph into something different on April 2nd. So right now, today, the date is March 27th. As of April 2nd, the federal law is likely to go into effect in some iteration that we know of at the moment under the CARES Act. But the Families First Act has already been passed. It is the law, and as of April 2nd, the sick leave benefits are going to change. So what benefits can I use for COVID-19 quarantine leave? Right now, we went through it. This is the same. It just states it a different way. For anyone who has 10 or more, 11 employees, so it's more than 10, and net income of more than $1 million, 5 days of sick leave has to be paid out for someone who's home. Just on this slide, can my employer require me to use my existing sick leave? No. These are straight from Governor Cuomo's office. I am not writing these out myself. These are not my answers for clients that are asking questions. These are the answers that I would give, but these answers are directly from Andrew Cuomo's office. These are the FAQs for the COVID-19 paid sick leave. So there is the link right there if anyone wants to go and read directly from the New York State website. The Families First Coronavirus Response Act was passed last week. It's law, and it is effective April 2nd. So it covers all small businesses that they count as private employers with fewer than 500 employees. Now, for people who are employing less than 50, you might qualify for an exemption from these requirements, but that exemption is going to have to come from the state, okay? So let's talk about April 2nd, what's going to happen. If you have an employee who is home under quarantine or isolation order, now again, not everyone can get to see a doctor. So if they have a reasonable belief that they are symptomatic, then they would be given this quarantine status. You could demand that they see a doctor by telemedicine and get actual diagnosis. You could ask that if you think that you have an employee who's just home with anxiety, and they would be able to receive that visit. So you could try. If the employee has been advised by a healthcare provider to self-quarantine, again, this could be by telemedicine. The employees experience symptoms of COVID-19 and seeking a medical diagnosis or actively trying to get diagnosed, and the employee can document that for you. If the employee is caring for an individual who is home, so someone else who is sick or might be sick. If the employee is caring for a son or daughter whose school is closed, it's going to be coverage for child care here. If the employee is experiencing any symptoms. So this is all the reasons why an employee would qualify under Families First Coronavirus Response Act. Now let's talk about what they get. An employee who is sick can stay home for up to 80 hours, which is 2 weeks of pay. So you have to pay paid time off for 2 weeks, full freight salary if the employee themselves are sick. If the employee is home because someone else is sick and they are taking care of them, the employee is entitled to 2/3 of the employee's regular rate of pay. So this is as of April 2nd, and these are people that are employed as of April 2nd. The employer will be responsible for paying for 2 weeks of quarantine coverage, PTO. This money, we'll talk about in a second, you'll get it back. Sorry, okay. The Act provides that the employer must provide employees that it has employed at least 30 days for family care coverage. Now, the family care coverage is going to be maxed out at $200 a day over a period of 12 weeks, which could mean a maximum payout of $12,000. So let's do the hypothetical. April 4th, your employee, Steve, calls and says, listen, I have to take care of my kids, and the kids are anyone under 18, that's school age, who are home from school. I can't come in. I need to be home, and I need to I need to have coverage, pay coverage. You will be required as Steve's employer to pay $200 a day for him to take care of his children. Now, how do you get this back? You will be entitled to a dollar-for-dollar tax credit for the money that you're paying out for Steve to stay home and care for his child. We are required to post a notice in our practices, and this is under Department of Labor, under the Federal Department of Labor. They will have the notices. We have to print them out, and we have to post them in our practice if we are open for our employees to see what the benefits are that are available as of April 2nd under the Families First Coronavirus Response Act. We have to abide by this, or there'll be severe penalties, as you can see. We are not allowed to retaliate, discriminate, and anyone who files a complaint, an employer will be investigated, and there will be substantial penalties for failure to properly pay out. So this is for you to understand that if you are open with staffing after April 2nd, this will apply. The Corona Aid, Relief, and Economic Security Act, which is also a federal bill that is making its way from the Senate now back to the House. The House is going to revise some language, and then it's likely going to go to the president for signature. This is going to offer potentially a loan product that will serve for payroll funding, full payroll replacement, and potentially with forgivable loans. So this is what Marco Rubio was talking about for a couple of weeks. If you've been watching a lot of the news stations, and I'm going to take you through what it looks like right now. Now, it's subject to change. The language that I have in here is a bit of a mishmash from both of the bills. This is the House bill up here. It says Senate, but it's actually the House version. And then the second link under here, assets.document cloud, this is the Senate version. So both of these versions have similar concepts in them. The amounts are different. The Senate version had $349 billion available for small businesses, and it was 2-something under the House version. So any profit any for-profit business employing not more than 500 employees is eligible to receive a loan from the government under this bill, if it goes into law, that will cover for payroll, mortgage payments, rent payments, payments of any other debt obligations incurred during the 1-year period before the date on which the loan is made. So you can get a monster amount of money to help you pay for all of your overhead. And the amount is going to be available to you is the total monthly payments for all of that for the period beginning March 1, 2019 and ending June 30th, 2019. So they're going to take it off of what you paid out last year. And it's going to be multiplied by 4. So it's going to be 4 months. Or it's going to be capped at $10 million. So what this is saying is there may be, through the SBA program, funds available for all of our practices to maintain operations as is, status quo, which is a loan. Now, most of it is going to have to be repaid at interest, which will not exceed 4% because the SBA program is capped at 4%. So they're saying they may make a loan available for you to pay all your overhead. So let's talk about what the forgivable part of it is, because this is what we want to hear. This is what the proceeds can be used for, which we just said: payroll, support, employee salaries, mortgage payments, rent, utilities, any other debt obligations. Okay, now these are we'll get to the forgivable in a second, but for a borrower, this is what the lender is going to consider. Were you in operation on March 1st, 2020? The answer for pretty much all of us is resoundingly yes. Did you have employees for whom you paid salaries for and payroll taxes? The answer is resoundingly going to be yes. So the answer is you would qualify, or you should qualify for this loan. The loan, which I told you has interest, under the Senate bill, there is complete deferment of any amounts due back for not less than 6 months. Okay, the House bill had 1 year. The Senate bill right now is 6 months. We'll see where they end up on it. There will be no prepayment penalty on this loan. And for eligibility purposes, lenders have to determine whether a business was operational and had employees for whom it paid salaries. That's it. That's going to be the only consideration. Now, I don't know which states they're going to use. That's going to change. The different houses are going to be looking at that. Senate versus the House. Congress hasn't decided yet, and we'll see which way they're going to go when it ends up on the president's desk. An eligible recipient is a recipient who's going to use funds for payroll costs during March 1 and June 30th, 2020. This is for loan forgiveness. My apologies. So for you to be able to keep the money and not have to repay a portion of it, you would use it for payroll costs. So money for payroll, the concept is that it's potentially going to be signed into law that all money that you take from this loan for payroll for individuals making $100,000 or less on an annualized basis will be forgiven. This money cannot be used to supplement the doctor's salary at more than $100,000 a year. That is not allowed here. It is meant to be for staff who are potentially laid off, possibly filing and collecting under unemployment. That is what it is meant to cover. And you will be audited on amounts that are paid out. There's going to be, terrible processes on this. This is a tremendous amount of money. So if you do take it, the paperwork has to be pristine. The application process you have to do very, very carefully. I know there are going to be a lot of people out there assisting with this process. You be very careful how you do it and make sure that you document everything and you keep very, very timely records. You will not be able to double benefit. So if you're paying sick leave out under Families First Act, or you're paying out the $200 a day to Steve under Families First, you will not be able to also get forgiveness on those amounts because you are entitled to a tax credit, which when is the tax credit going to be effectuated to you? Your guess is as good as mine, probably a year and a half. So we're not banking on that as cash in pocket at the time being. So application for loan forgiveness. Now, here's some good news on it, and we'll get to it next, but an eligible recipient seeking loan forgiveness shall submit to the lender an application for forgiveness, and you're going to have to show supporting information, which is going to include payroll tax filings, state income payroll and unemployment insurance filings, financial statements verifying payment on debt obligations. So a lot of information, and any other documentation the administrator determines necessary. So you want to be very careful who you get this loan from, who is going to adjudicate this properly. I know I've spoken with Signature Bank. They will be administering it. I'm checking with BAML, TD Bank, all the banks that we probably have been using for our funding that's specialized for doctors will likely be administering this. So call your regular banker. Don't just call an ad or someone advertising. Call right now who is potentially doing some financing for you and see if you can get in line in their application process. Now, here's limits on loan forgiveness, which is very, very important because all of us are going to likely see a major revenue dip during this time period. So it's not as if we're going to have tons of cash available to just have around to just repay money that's given out to carry salary and other areas during this time, within potentially the deferment period, which is going to be 6 months to 1 year. So it might only be 6 months. So limits on loan forgiveness. It's going to be capped at the sum of the total payroll costs during the covered period. And the payroll costs are going to be checked. Loan forgiveness should be reduced by a percentage accounting for difference in staffing from a year over year. So they're going to calculate the number of employees, and then they're also going to, and I don't really understand this language, I think it has to be fleshed out more, and there's going to be additional information available through the Treasury Department over the course of, I think I have the slide in here, how many days, so we'll look at that later. But they have reduction relating to compensation. So I know that they're supposed to be covering for salaries under 100,000 annualized, 33,000 for the period from March 1 to June 3rd. And again, these dates may possibly change depending on which language is adopted, the Senate or the House bill. But they have in here that they may reduce the amount of loan forgiveness in excess of 25% of compensation in the most recent full quarter in which the employee was paid in compensation and who was compensated an amount less than $33,000 during the period. So I'm not exactly sure the language. This is straight from the bill. I think it's going to be clarified, but we certainly are going to have to read with a fine-tooth comb next week the language that is coming out of the final law. So on loan forgiveness, this is great news. In the Senate draft, it says not later than 15 days after the date on which a lender receives an application for loan forgiveness, the eligible recipient will know whether or not it's going to be paid back. So if you do apply for this loan and then you get the money and then you find out that you are not going to be able to have it forgiven, you can give the money right back because there's going to be no prepayment penalty on it. So it seems like a fairly safe bet in its current iteration. We'll see what it's going to be. Now, no eligible recipient shall receive forgiveness without submitting to lender that originated the documentation required. So you have to have your documentation in order to be able to get this. Now, the canceled indebtedness is going to be excluded from gross income for all of my listeners that are very involved in their tax business. This is how it's going to be canceled because, as you know, canceled indebtedness is also earned income in many instances. So we have to be careful on how this is treated, but they've already contemplated the tax treatment and it's in here. Not later than 30 days after the date of enactment, the administrator, who's probably going to be the Department of Treasury, shall issue guidance and regulations implementing this section of the loan forgiveness. And here's the link again for the actual law for anyone who wants some light reading. Loan forgiveness under this section shall be determined without regard to reduction in the number of full-time equivalent employees that you had. So let me be really clear. If you fire your staff and you want to try to go for this loan, once the loan is available, if available, you can rehire your staff without any penalty, as long as you do it in the current iteration 30 days after the date of the enactment of the act. So I have no idea what date this law is actually going to come into play hasn't been signed yet. We do not have final language, but you will not be penalized if you had to close during the time period, and then you look to take money to pay salary as you start to come back on board. And while you ramp up, you could potentially take advantage of the loan process that's being given here. Now, there is a grant, essentially a grant that's being offered for individuals who are looking to apply. There's $10,000 that's being made available for individuals who apply and want an advance. And that is still being fleshed out what that's going to look like. But be sure to touch base with your bank. And if you don't have any loans right now, or you're not that close with your banking relationship that has your depository accounts, now is a good time to reach out. They are being incredibly responsive. They are all working and open, and start asking questions about the $10,000 grant that might be available, even if you don't take this loan, and then start getting in line to see what the loan might look like if you were to looking to avail yourself of it. Again, most major banks are going to be participating. Now, let's talk about if you did lay off your staff, or if you're looking to lay off staff because you simply cannot carry the payroll until we know what this is going to look like, or you need to reduce staffing. The CARES Act, as stated, is creating a federal pandemic unemployment compensation stipend, which is equal to $600 per week for an employee. This is tremendous because right now, as we know, New York State's unemployment system pays essentially the equivalent of a $26,000 a year salary. What the federal is doing is they are giving money to the state that for every individual who is on state unemployment will receive an additional check of $600. So the language specific that's in the law right now, as it is drafted, which might change, is that the state will make payments of regular compensation to individuals in amounts and to the extent that they would be determined if the state law of the state were applied. So they get what they're going to get under New York state law, which is a complicated formula based on how much the employee makes and how much they work and this and that. And then with respect to any week for which the individual is otherwise entitled under the state law to receive regular compensation, the state is also going to pay an additional amount of $600. So they're going to pay it weekly. The state can pay it with its check, in addition to its check, separate check, but it has to be paid weekly, and the money is going to be available for that to be paid out. Recovery rebates. I put this in here. It's just a summary of what's in here for individuals, and it's likely going to be available for your staff. Many of you probably will not qualify, but individuals who make $75,000 or less, and this is under the Senate version. The House, I think, had $90,000 in it. So I don't know which one it's going to be, but it looks like a salary of under $100,000 for an individual and $150 around that range for a household will be entitled to a check of $1,200 that they'll be getting in the mail. And it's in advance. It's a refundable tax credit, right? So that's how it's being carried out by the government. Okay, so before I move to business interruption insurance, I want to just summarize what we've gone through because it is a tremendous amount of legislation and information. For our practices, there are several options for salary replacement right now for staff, or I should say for salary payment for staff. Number one, you run a full payroll and you pay everybody during this time, whether you're open or you're not. Number two, you cut down staff hours because you just are not open and you do not have that many emergency visits, or you're opening part-time, or you're not physically opening, but you need help administering teledentistry and you need help for patients to be rescheduled and patients to be called and whatever it is, you need help. You need billing support. So you're keeping some people on part-time. If you're keeping people on part-time or you're closing the office entirely, your staff may be eligible for unemployment benefits. And I'll get to the unemployment page when we get further down. But I want you to understand that. The staff might be able to access unemployment benefits, which they can file for and collect right now if you have reduced their hours or terminated them, okay? With the new law, you may be able to get money to pay payroll. If you bring everybody back and you open up completely, which you will do at some point, and the money that you use for payroll, assuming that you're very meticulous in your records, you have very good documentation, you're ready to turn over your taxes and all of some financial data, you may be able to keep all of the money that you received and use for payroll during this time. And a lot is up in the air on process and that determination. You also may not know until you get the money and you hire the staff back whether or not the loan will be forgivable. So that is what the current iteration looks like on the loan. For our people that we do have on salary, we know that as of April 2nd, we are going to have an obligation to pay for additional sick leave and possibly childcare that we went over with the families first. So now that we've covered the atmosphere for staff and options, I just want to encourage you and a few other small things. For business interruption, I know everybody has said no, that we are disclaiming coverage, insurance is not paying for this. Please encourage your brokers again to put the claim in for you. There will be a lot of litigation in the coming years, and best practices is for you to get in line. So please encourage in your business interruption insurance. Speak with your accountant. The pay date for taxes has been moved to July 15th. That does not necessarily mean a delay in filing. So you have to make sure that you are filing properly. For your landlords, my experience has been that landlords are not willing to give any type of abatement right now. Landlords have been willing to give a deferral on rent from what I have seen. So the rap that we've been hearing for our clients is that landlords are willing having to pay their taxes during this time. They're having to do their debt service. They are not amenable to a total deferral right now, but they may cut a deal with you. Okay. Okay, sorry about that. Working from home, distraction. Okay, teledentistry. You are encouraged by the government to engage in teledentistry, and I want to just go through some of the codes that might be available for you. This is straight from the ADA. I'll leave this up for a minute and we can just talk about it. I'll let you peruse the actual codes that are available. But teledentistry is accessible on a myriad of platforms, and they have different levels of HIPAA security. I would encourage you to please utilize a HIPAA secure platform. OCR, the Office of Civil Rights, has relaxed HIPAA enforcement during this time. However, safer is better. So while you could use FaceTime, and which, potentially if that were to be hacked, that is an Apple product, I believe. So we would all be in a bit of trouble. But I would prefer for you to use a platform that is HIPAA compliant. Again, I'll release the slides and I'll just go back here for just 1 second. The ADA website, if you look at coding and billing guidance section, they will have information for you on the teledentistry, and you can access these codes. This is a good way for many of you who are home now and taking calls from patients and talking through with patients. You should absolutely be billing for your services. So there's no reason not to use these codes. Okay. Terminating employees. And we've talked about this before earlier in the week. I have a real problem with the word furlough. I believe that its usage really can be problematic for employers that are not necessarily coming back online all at once, full freight. It looks like the way that things are going, it's not bad to bet that this is a faucet that's going to be turned on slowly, and some of you may be looking to add days here and there and go in for emergencies only for a little while, and then hopefully we'll be adding and adding and adding and getting back to normal. With furlough concept, I view it as you're promising the employees that the status that they left on will be reinstated all at the same time, full freight. So I prefer that the status that employees be conveyed if you are not going to be opening and they are not working right now is for them to be terminated or essentially constructively terminated and moved to part-time if that's what you're doing. If someone was typically 40 hours a week and now you only have 8 hours because they're coming in to assist you for one morning and then they're working from home for the rest of the day, then that person would still potentially be eligible for unemployment benefit for the rest of those hours that they are not getting from you anymore. So just because your employees are, there shouldn't be a stigma to applying for benefit right now, because employees need to be supplemented for the lack of hours if there is less hours. Now, if you qualify for the loan and you're going to pay them for all hours under the forgivable loan concept, that's a different story. But to be paying full freight right now, when you're not going to do that, because most of us are working in line with the proper laws promulgated under the Department of Labor. We do have hourly staff. We have not misclassified employees as salaried. We are required to pay on an hourly basis and overtime for anyone who is not an exempt employee, which the majority of our staff, pretty much all of them, do not qualify as exempt employees. So they are hourly, and now you're not giving them as many hours. And so the stigma for unemployment, I think, shouldn't be propagated, because there's going to be millions and millions and millions of people on unemployment during this time period. And that is one viable mechanism for salary replacement. Also, this loan construct under the CARES Act looks like it will be a second. So terminated employees may be eligible for benefit, and that benefit is going to be supplemented by the CARES Act law when it goes into place, hopefully, fingers crossed. Now, when we terminate, I didn't speak about this before on the essential staff, and I want to speak about it now because I think it's important. We should be having the next, 1 or 2 or 3 weeks while we're under this pause, staff come on site who are essential to the on-site services. We are supposed to be having individuals work from home to the extent they can. So if your biller has the capacity to work from home and access, and your scheduling coordinator has the ability to work from home and access, we are supposed to be deploying those measures. And for individuals who are not complying with emergency-only services, there may be ramifications. The state could come in and shut you down. They could fine you. So you don't want it to get out that you are providing merely preventative or non-emergency services at this time. For health insurance for your staff, COBRA is typically the mechanism that a fired person is going to be utilizing. I've seen some employers look to extend out their existing plan document for an additional month. Some of the plans are allowing it. Others are saying, no, COBRA is what you have to do. Now, what some employers are doing is they are paying a portion of the COBRA. Not everyone, and there's no pressure for you to pay that out of pocket. But if you wanted to give a contribution to the employee's COBRA, that would be an additional amount and not constitute salary. And so it would not impact the employee's benefit on the side. Severance, you're not required to pay any severance. If you are terminating employees right now, you are required to pay out any accrued PTO under your own current policy. And I'm happy to speak offline about that if anyone has any questions on that statement. This is a sample termination letter because I was asked to please provide this. I think the main elements in here are the employment status, that you are terminating the employment status, or the employee is going to part-time or whatever the status is, the status has to be in there. And then the notice that you may be eligible for unemployment benefits during this time. And you recommend contacting the New York State Unemployment Department for further information. Many practices, or pretty much all, put a personalized message or terms of endearment into this letter. They want it to be personalized, and that's, of course, fine. Nothing wrong with that. This is straight from the New York State Unemployment website, and these are the benefits, that section that you would be giving. So due to COVID, there is actually a waiver of the 7-day waiting period for unemployment insurance for people who are out of work. So benefit is available immediately, and that would include, hopefully, fingers crossed, the additional $600 a week under the federal stimulus. So these were some basic questions that I received a lot from many people. These are frequently asked questions from the New York State Department of Labor website that I pulled for us to answer. What if I work part-time? If you work less than 4 days in a week and you earn $500 or less, you may receive partial benefit. So this is the state answering, you may be entitled to partial benefit if you are working less. So that's the answer. Your employees that you're cutting the time, they should be filing. Can I file a claim if I lost my full-time work but still work part-time? Yes. Resoundingly, the answer is yes. You can file a claim. Put a claim in, enter the date of your last day worked. I don't know if you can see the mouse here, but enter the date of your last day worked. Enter the last day you physically reported to work, regardless of whether this is your full-time or part-time work. So it's important for employees to get this letter because it's going to have, and I should have put a date on it, it's going to have a date on it, and it's going to tell them when their status was changed. Many of us who are hemming and hawing over, I can't carry them, I can't pay them, I don't have any money coming in, I'm just going to do them a service. You can do that, and you can continue to torture yourself. If you know you can't carry them during this time, you should know that there are potentially benefits available, and the messaging to the employees should just be clear. You certainly don't want to have a period of time where you have no intention of paying them, but you have not actually told them that, and then they have lost benefit or potentially will lose benefit. And they would have a claim to you, to the Department of Labor, for not paying wages, which is as serious as it gets for an employer. And the Department of Labor will be fully operational at some point, and there are substantial fines, treble damages that are attached to failure to pay wages. So employees are going to be watching this time period very closely, as they should, and we need to be definitive on strategy. So questions on termination, and these are questions that I've received a lot. Do I have to fire everyone right now? Can I just reduce hours and pay? Absolutely. Many of us are maintaining hours in our practice for emergency services. Many of us are not having those hours, and we're referring patients out. I know that there are dental practices that are open, they are rendering services, and they are equipping themselves to handle overflow as needed. If we are going to close, but also quasi stay open because we need certain staff to answer calls and we need billing follow-up and we want to send updates to our patients, so we need staff to help with that, then it sounds as though you would have 1 or 2 of your people working part of the time. Is that 10 hours? Is it 20 hours? I don't know. Everyone operates a bit differently. They have different support from their staff. They rely on them for different purposes. And it's not a one-size-fits-all answer. But for those that you have reduced, they are potentially able to collect unemployment. And so they should be filing, whether it's partial or for full. How do I fire an associate dentist with a contract? We are closed and I cannot make payroll. This is one of the more difficult questions because an associate dentist with a contract likely is not an at-will employee. They likely have an agreement that says you have to provide them 30, 60, or 90 days notice. And you may be paying them a day rate, you may be paying them based on production, or you may be paying them a salary. Without looking at the dentist contract, I cannot answer specifically what you would be responsible for doing. But if you have a dentist agreement where you are paying a salary or you're paying even a day rate and you're promising days, and you also have a 30-day termination provision in there, arguably the dentist would have a claim to those monies during this time period. Now, also remember what I said about the loan. The loan is for individuals to be reimbursed for up to $100,000 a year in salary. So the loan is not going to solve all of your problems with the associate dentist. My best advice that I can give you right now, which if needed, I'm of course available and happy to help you with, is to have your discussion with your associate dentist and to say, look, this is a national crisis. This is a pandemic. I need your cooperation for you to have a job to come back to. I cannot make payroll. And see what they say. Some practices are going that route and memorializing with the human beings that work for them that, you know, they will be taken down, or they'll accept 25% or 50% of what they were making during this time, and they will be available, and they'll do teledentistry and all of these things. Or the practices are taking the route that they are just unilaterally going to be taking these actions. They're just taking them off the payroll, no conversation. They are sending out, I saw one large practice, not in dentistry, in another specialty actually, just send out 100 amendments to associates, and the doctors were expected to just sign it and send it back. This is going to be an absolute mess. There's going to be litigation over this for a long time. So if you can get an agreement with the dentist, even if it's by email, that they are accepting a lower rate during this time period, or they are waiving notice provisions, or whatever it is that you agree to with them, put it into an email chain and put it into your folder. And I recommend that you do that this week, early next week. Do not wait as this rolls forward, because it'll be too late. That's my advice on the associate dentist. For the associate dentist on the call, because I know that we have some, I hear you. I know you need the money. I know you need to be paid. You need to work something out, on the same thing on the flip side, with your employer, and you need to come to an arrangement that you can live with and that the employer can live with during this time. If you're willing to make yourself available, if you're willing to see emergencies, let it be known. Speak up and see what you can agree to during this time period. Obviously, revenue is severely impacted. Any associate dentist that does take a very strong contractual position, I know that from working with many employers, that is not going to be seen as a good citizen position, and it's going to make them rethink about having you back, which is not a threat. Maybe you want to leave. Maybe now is the time to discuss parting ways. Maybe instead of you being paid out during this time, if you're not happy there, maybe you get a break on your restrictions, and in lieu of the contractual notice that you might have. And that might be a conversation that you need to have now. If I fire the staff, how will they maintain health insurance? Well, you'll either continue the health insurance if you're authorized under your plan to do so for some period of time, or it'll be through COBRA that you may or may not contribute to. Can you pay for the COBRA? Yes, you can pay for the COBRA if you want to. Now, on the stimulus package, we went through this on the loan. Maybe you can get a loan. Yes, the strings will definitely be documentation. You need to be able to show what you're using it for and what's for payroll. When will the money be available? I don't know. I am hoping within 2 weeks. I am not sure, but I will know probably more next week. Okay, on reboot, if my employees are on unemployment, can they come back to work for me part-time? Yes, employees that are on unemployment can work for you as many hours as they agree and you want to give them, and whatever you pay them for that time, they will report to unemployment, and they will likely see an adjustment to the unemployment amounts paid out. Will I need new employment contracts when this is over? That one depends on what you currently have in place and how we're going to be treating benefits. So we would deal with that on a case-by-case basis. The answer is possibly. Will I be in trouble for not doing everything right? I want to be really clear here. There's not necessarily a right versus a wrong. there is a lot of gray in our current situation right now. So all we can do is the best that we can with the information that we have, and then we're going to see how everything shakes out. We already really covered this on the associate dentist questions, so I'm going to move on from this one. So this is the resources page that we've put up. It's a work in progress, but we've put some of our materials up. We'll put some webinars up. And, let me see here if I can, it's very difficult to view the questions in this program. That's one of my complaints on this. So we do have a lot of questions. I'm going to see if I can read through some of them. I'll stay on for an additional 5 minutes if we're at a little bit at our time. Okay, so what is the difference for me as an employer on my staff file for unemployment now versus wait until after April 3rd? If she is hourly salary, not weekly, and plans to work 1 day a week on billing and rescheduling. So I think we answered this already, but you can have the staff file for benefit if you've reduced their hours or if you've terminated them completely. And then if you hire them back or you give them certain work, they will have to report to unemployment each week before they get their check how much time that they actually worked that week, and they will just report the hours that you gave them and go from there. Okay. You have individuals that want to stay home and would prefer to not work. What am I responsible for? Well, again, only if they are on mandated quarantine or isolation because they have a good faith belief that's medically backed that they have COVID, you would be required to pay out right now the 5 days of paid time off under New York state law. And then if you qualify with the 11 or more employees after April 2nd, you would be required to pay out 14 days of PTO. Okay. I, as a practice owner, get a W-2. Can I apply for unemployment? So interesting, on the unemployment website says that if you are getting a W-2 out of your own entity, you will not, the entity has to be closed, completely dissolved for the owner to receive unemployment benefit. So during this time, I'm not sure if the federal stimulus is going to have reprieve from that. So I'm not going to say whether you should or shouldn't file a claim. We're going to see what the final language is in the federal stimulus package. But if you're a sole proprietor, I think that that's a little bit cleaner because you ceased operation and there's no revenue coming in. I did not see a prohibition from a sole proprietor, just a corporate entity that has control over distributions. They are having, they're saying that you can't file. Okay, so from the Tuesday webinar, I heard you start the process for overhead insurance, and they discouraged me from applying. But so should I apply? Yes, I understand that your brokers are discouraging you from applying, and they may even say to you that there might be an increase in premium for you to put the claim in. But I don't know. I'm not buying it. I think that it's an issue that I would rather be in line than not. I have paid my staff of 4 for the 2 weeks we've been closed. For the 3rd week, I should tell them that, sorry, I think that, so for the 3rd week, what should I tell them? Well, that's up to you. I mean, I'm not going to tell you not to carry your staff. It's up to you whether or not you want to carry them on your payroll or not. I'm not sure if you're open for partial time or if you're looking for their assistance for teledentistry or what they're doing for you. But I'm laying out for you what the options are, and there's extended benefits available. There's going to be the potential for this loan construct maybe in the next couple of weeks. But, my job as a counselor is to hear a situation and to give advice. And I cannot tell you with good conscience when the loan money will be available. It's not signed into law yet. I might have a better idea later next week. and then speaking with the banks that we're in touch with, I'll have a better idea on when the money will actually be in your hands, and we'll have a better idea on what the loan forgiveness is going to look like. Now, one of the concerns that I do have is using the money for payroll, not having the documentation done properly, and then not being able to avail ourselves of the loan forgiveness and adding everyone back full freight. So without having guarantees that it's 100% forgivable on at least the salary component, we have to be careful. If we rehire by 6:30, will they waive any reduction in forgiveness? What if Cuomo keeps us working past that date? So right now, if you have let staff go, you have a period of time. It says the current iteration says 30 days after the law after the bill is signed into law, and it's effective. So you would have time to rehire staff when you need them. If we're going to start opening up in 3 weeks or 5 weeks, I'm not sure when that is, and maybe some of you have better insight into that than I would. You are going to want to ramp up and pay salaries when you may not have that much revenue coming in, and you might want to use some of the loan funds. Will there be money left for you at that point? I cannot guarantee that. Will the money that you take at any point for salary be forgiven? That's the idea, and we'll see how it's going to play out. So I think we need some more information on the loan forgiveness, and it's your decision as the owner whether or not and in what capacity you want to carry staff at this time. So let's see here. If you were the business owner, this is the same as the W-2 for the unemployment. I told my staff we're only open for teledentistry. Okay, good. And I asked one person to come in for paperwork after April 4th when things settle down a little. Is that okay? Do I have to do anything? So look, I do have plenty of people that are having individuals come in for mail and necessary paperwork that they don't have at home. So I'm not going to say don't. You are essential. You're essential to the public and to our economy and for our health. So if that's what you need to get things done, you're authorized to do it. Your staff, by association with you, are essential. Now, the government's not giving out letters for you to give to your staff for them to be driving around with. You might want to write up something for them to be traveling with, possibly, that where they're headed and what they're doing, and that they are working for your practice. I've seen plenty of employers doing that. Okay. I think this was more a complaint that in the cap for the stipend. Okay. The staff stopped working several weeks ago. Sorry, it's very hard to read these. But her choice still does not want to come back to work. Oh, this is a big problem, right? I mean, I know we're all worried about this. What if I put the staff on the unemployment and the unemployment is so good? They were making $45,000 and now they're making exactly that. I don't know what the unemployment is going to look like with a federal stipend, because there's going to be adjustments based on rate. So your employees, there's no way that the stimulus package is going to look that your employees are making more money than they would working for you while they're on unemployment. That's just not going to happen. The unemployment benefits are going to be available under the stimulus, it looks like, for a period of 4 months. So most of us are going to be open in, hopefully, knock on wood, in some capacity, right? Well within that time period. So we need our staff to come back. We're going to see. I have a feeling it's still going to be a percentage of the total salary they would be entitled to if they were working for you directly, but I don't have enough information on that. Okay. What platform can I use that's HIPAA compliant for teledentistry? I'm going to leave that to the group. If anyone wants to send me some links on what they're happy with, I'm happy to share it with Beverly and Dr. Porcelli for the Nassau County newsletter. I'll put it on my newsletter if you'd like. Okay, so I think I'm going to wrap it up for today. And if you want to have another one of these, you can let Dr. Porcelli know, and we can schedule it for next week after we have even more insight, and I'm happy to do it. If you email me, I will do my best to get back to you as quickly as possible with your questions. And the ones that are more communal, I'll use for a newsletter, and I'll do an update for Nassau County if they'd like, that we can email out too. And I foremost hope that everyone is well, and thank you for all that you do. Okay, I'm going to end the webinar for today. Have a great weekend.